Hello, my name's Aidan Richards. I'm a plastic and cosmetic surgeon and also the surgical director of Aurora Clinics and Cosmetic Courses. And Cosmetic Courses is the largest training course for medical professionals in non-surgical treatments such as Botox and dermal fillers in the UK. In this video, I'm going to be talking a little bit about facial aging, and this is actually part of our foundation course lecture for our foundation course. Now, the lady on the left here probably looks in her early 60s, the lady on the right, early 80s. 20 years between them. What's the difference? Well, this is a very, very famous photograph. These are identical sisters who both went to work in a country house as children. This sister went to work in the kitchen. This sister went to work in the garden, and you see 20 years of difference in the aging in the faces is really because of ultraviolet light and sun damage to the face. The volume loss and gravity changes are very similar, so you can see that we can make an awful lot of difference by preventing UV light damage with sunblock. So skin damage, really important. The other major factors in facial aging are gravity, active lines and volume loss. Gravity changes are generally are treated with surgery. Active lines, because they're caused by the underlying muscle activity, treated with selective weakening of the muscles with Botox, and volume loss is generally treated with volume restoration treatment with either hyaluronic acid or fillers. So this lady, I think, is in her early 40s. She's typical of the patients you will see, your non-surgical patients. She's an attractive lady. She's got good skin, looks after herself, but she's just showing the first little signs of lines here on her forehead, which are caused by the frontalis muscle pulling up. No real lines in her frown areas, small little lines here, and not much volume loss with good skin. So that puts her down at about 40 and would be an ideal candidate for Botox treatment. Here she is at 50, so look at the difference. So 40s, early 40s, and then early 50s. And we can see that there's more ingrained lines here in the glabella, more ingrained lines in the forehead. And I don't know if you can see that. There's a greater movement of volume to the lower part of her face. So in her 40s, most of the volume's in the cheek areas. But as we can see, in her 50s, she's become slightly fuller in the lower part of the face, which is very characteristic. So again, our priorities for this lady would be Botox treatment, possibly fillers, and skin care advice. So that's her in her early 50s. Moving on, here we are, early 60s. So let's just go back. Early 40s, early 50s, early 60s. And you can see that the main difference between the early 50s and the early 60s is volume loss in this area. So in the decade between the early 50s and the early 60s, let's just have a look. Can you see? Just concentrate on the volume here. If we look forward, there's quite a lot of volume loss here and also further fullness and jowl formation. So our priorities really in this decade would be dermal filler treatment to the lower part of the face. Moving on, this is our patient in her 60s, and you can see there's been further volume loss. Her skin's become much thinner in that decade between her early 50s and 60s. And again, our priority in this decade would be dermal filler treatment in this area, skin care. So this is a typical patient, again, probably in her early 40s. She's very fit and healthy. She's asymmetrical, interestingly. Look at the volume, look at the distance from her lower eyelid there to the length of her lower eyelid on the right side compared to the left side, much longer on the left side, and she's got much less volume on that side. So you can see a lot of our patients are asymmetrical, and this is her more tired side. She'd normally prefer to be photographed from that side. She's got less volume on this side, and this, interestingly, will probably be the side she sleeps on. So after dermal filler treatment, which in this case was a Restylane, you can see she looks better, I think. Question is, does she look younger? Well, I'm not sure she looks particularly younger, but if you hadn't seen this lady for a month and she came back and you saw her again at a social event or at work, you'd probably think she looked better, like she had a good rest. It'd be difficult to actually pinpoint exactly what it is that looks better about her, but I think she looks fitter, healthier, and more vibrant. And a lot of our patients would say, I feel great, I work out, I'm fit and healthy, but I don't feel my face reflects that. And I think dermal fillers can restore a lot of that lost volume. So thank you very much for watching the video. If you are interested, if you're a medical professional and you are interested in learning more about Botox fillers, skincare, if you're thinking of perhaps changing your career or adding another aspect to your existing work, please have a look at our website, Cosmetic Courses, and then you can also look at our Academy site, which is our training site, which has lots of downloadable material and videos. That's on Cosmetic Courses. We've also got a very active podcast on iTunes, which you can listen to, which has lots of information about what's happening at the moment about in the cosmetic industry. So have a listen to that. Just look for the Cosmetic Course podcast on iTunes. And if you feel you would like any more information about courses, please email us or phone us, and we'll be absolutely delighted to give you advice as to the best way forward for you. We've trained nearly 1,000 medical professionals now, and many of them have developed very, very successful non-surgical careers, developed their own businesses, their own clinics. So we're, I think, ideally placed to advise you how best to achieve this for you. So thanks again for listening and watching the video. We hope to hear from you and see you at one of our courses soon.